Hello, I'm Mbeubeuss, a Master's in Public Health student at New York University. In this video, we will discuss a common outcome of urbanization that is a global public health issue: open landfills. In the Western African country of Senegal is Mbeubeuss, the country's largest open-source waste site located in the city of Dakar. The purpose of this video is to understand what Mbeubeuss is. What public health risks and benefits does it pose to the community? And lastly, how, as public health professionals, can we address the issues and monitor the outcomes? Essentially, how can we prevent public health issues like this from occurring in the first place? The video will begin by discussing the timeline of crucial events that shape the outcome of Mbeubeuss, how urbanization has impacted the waste site, what health concerns this poses. We will also look into a couple case studies on lead and dioxin levels in the community, how some are in favor of Mbeubeuss, different levels of interventions, and finally, future implications on how to best implement interventions to benefit the local community. The Mbeubeuss landfill was established in 1968, but majorly left for the residents to maintain. In 2001, Senegal joined the Global Stockholm Convention, committing to work towards reaching EU sanitation standards. In the same year, the government decided to initiate the closing of Mbeubeuss and relocate to Gandol. Both residents of Gandol and waste pickers of Mbeubeuss protested against this in 2004. The site remained open until 2020, when the World Bank funded a $125 million project that included funding a waste separation center and composting center to be built on the site. The waste separation center is set to be built around 2025. In this line diagram, we can see how urbanization has changed over time since the establishment of the open landfill. From 1960 to 2020, the overall population of Senegal has increased by fivefold, while the ratio of urban population to total population has increased by 11-fold. As the ratio of urban population essentially doubled from 1960 to 2020, so did the waste output. The lack of planning for urbanization has led to an increased problem with unsanitary landfills. The Mbeubeuss site is located in a dried-up lake, parallel to the Atlantic coast. This site is where trash is collected from 80% of Senegal's residents. In 2014, out of 2.4 million tons of mostly organic solid waste, 1.1 million was left uncollected and was left to the residents to dispose of themselves. Lack of proper urban planning, along with the population increasing dramatically, often results in dumping into the ocean, burning, and open defecation. Furthermore, Water Waste Report has estimated that Senegal's waste output is set to triple by 2050, which puts more urgency on the matter. This aerial view of Mbeubeuss shows trucks driving up to the dump site. As the population has increased, so has the size of the landfill, from 14 to 114 hectares. The lake, located on the outskirts of the landfill, is red from pollution of heavy metals such as iron. Also pictured are the communities built right along the site, where approximately 400 people live. Who maintains Mbeubeuss? The residents are left to maintain the open landfill themselves. Approximately 400 people live on Mbeubeuss, with 2,000 waste pickers regularly on the site. Among these, more than half are men, almost a third are women, and about 10% are children. As you can see in the images shown, they collect metals, plastics, and any other material that is able to be sold for reuse. Some make a total of $5 a day, but at the cost of coming into direct contact with toxic waste daily. Of course, recycling some of the materials is not a true solution, as the non-recyclable waste must be treated. From a public health perspective, Mbeubeuss poses several risks to the health of the local population. the waste pickers of Mbeubeuss are exposed to multiple forms of pollution from the air, water, and food grown on the nearby land. An unlined landfill will leach into the ground and contaminate the soil and groundwater, which the locals use to grow food and as their main source of water. Untreated waste attracts pests that can expose people to disease such as rats and mosquitoes. High levels of methane are also released, which is a large contributor to greenhouse gases. Waste mainly composed of household waste will contaminate the soil and water with lead, zinc, and iron. No amount of lead is safe in the body, and excess zinc and iron can have severe health impacts from GI stress to impacted neurological development. The final environmental and social impact study report of the Mbeubeuss landfill removal operation from the Ministry of the Environment showed that waters of Lake Mbeubeuss are characterized by contamination by hydrocarbon, iron, selenium, zinc, sulfate, fluoride, and fecal coliforms. Contamination with cadmium, chromium, manganese, lead, sulfate, and fluoride is likely. Also, around the Mbeubeuss landfill, physiochemical, bacteriological, and biological analysis have shown that heavy metals such as lead and cadmium have high content from upstream to downstream below the landfill, accumulating at the lake level. The fires that are often started to isolate valuable materials or that occur by accident release many toxic chemicals into the air. These chemicals include organic pollutants that contribute to the 1 in 10 children affected by asthmatic symptoms in the area, most of which go untreated due to lack of access to medical care. Locals who are tired of the growing problem are considering leaving the area. In interviews with several families, it is evident that this is an urgent issue that is impacting generations of Senegalese people. Locals also state the health authorities have informed them that their tap water is unsafe to drink, which has prompted them to add bleach to their tap water. The families are tired of the smoke and dust and are worried for their children, many of which suffer from chronic diarrhea and asthma. Assessment of lead exposure in children aged 1 to 15 years old residing near the Mbeubeuss landfill were carried out in 2013. The results of measuring lead at the landfill site have confirmed the amount of pollution, with an abnormally high rate of 1,129 milligrams per kilogram. The average blood lead level of the exposed children is 150 micrograms per liter, higher than that of the controlled children, which is 96 micrograms per liter. No amount of lead is safe for the human body. Lead also has long-term harmful effects in adults, including increasing the risk of high blood pressure and kidney damage. Exposure of pregnant women to high concentrations of lead can lead to miscarriages, stillbirths, premature death, and low birth weight. As previously mentioned, many suffer from respiratory-related disease. In 2019, out of their 111,596 hospital visits, 32% of the visits in Mbeubeuss were respiratory-related, compared with 19% in the Dakar West District. More cases of respiratory illness occur in Mbeubeuss. As seen in the images to the right, the smog from the waste and fires is so thick it is visible to the human eye. A site that has farming and agriculture in its vicinity, the runoff from Mbeubeuss contaminates the soil and groundwater, which the residents rely on for consumption. Persistent organic pollutants, or POPs, are those chemicals targeted by the Stockholm Convention to reduce and eliminate in the environment. They are also given the name forever chemicals and the dirty dozen because they take a long time to break down in the environment and cause significant harm to human health. Over 100 countries, including Senegal, have signed this treaty and promise to work towards reaching EU standards. A category of POPs include dioxins, which are a group of unintentionally produced chemicals when burning PVC, plastic, or other chlorine-containing materials, which occurs regularly on the site. According to the EPA, dioxins are highly toxic and can cause cancer, reproductive and developmental problems, damage to the immune system, and can interfere with hormones. One study investigated the potential contamination of dioxins, polychlorinated dibenzo P-dioxins, and dibenzofurans by testing their concentration in eggs grown on a local farm. Eggs were chosen due to their commonplace in the local diet, as well as their fatty acid content, which hydrophobic POPs would be soluble and measurable in. In conclusion, the dioxin levels measured from the eggs from the chickens raised near Mbeubeuss were 35.1 picograms per gram of fat, more than 11 times higher compared with the EU limit of 3.0 picograms per gram of fat. This suggests that water and soil in Mbeubeuss is contaminated as a result of the waste. Many people rely on the landfill to provide for their families. Over 400 people living on the site and 2,000 families depend on the site as their main source of income. By maintaining the landfill for the past 50 years, they paved the way for the structured separation and treatment center. Their threat of their livelihood being taken away from them catalyzed the formation of an association known as the Bokion, meaning our shared pride. Members have the belief that while we see trash, they see treasure trove. Some feel a sense of ownership over the site that they have been maintaining over the past 50 years and prefer having the freedom to work under their own conditions. Others make their business selling food and water to the workers on site. However, worker inequality does exist. While women typically are only allowed to collect less valuable materials such as food scraps to provide meal for pig farms, the men get to deal with plastics and metals worth much more. Similar to many other countries, including the U.S., the women struggle with lack of support when having to take care of the household and work a job to provide for their families. Furthermore, the site is not maintained in a safe manner and poses grave health risks to those in the vicinity, particularly the over 500 women and 200 children working on the site. After receiving funding and support, the new program proposed by President Macky Sall will feature a waste separation center similar to the diagram on the right, where waste will be separated and treated to work towards EU sanitation standards. This project aims to create 10,000 new green jobs, provide training for those dependent on the site, secure access to the site, and deterrence of waste burning. They also aim to provide a health program and child care assistance to families working on the site. This installment can work to improve living conditions, which can help revive the tourist population and improve the local economy. Going forward, further steps need to be taken to learn from Mbeubeuss. More disease prevalence surveys need to be done to understand the true chronic and acute impact of the landfill. Involvement from the recyclers, community actors, health authorities, and administrative authorities need to work together to transform Mbeubeuss into a safer place. Training and hiring waste pickers to treat waste rather than burning it. Proper recycling of waste. Support the health of waste pickers. Educate the community living on the landfill of the long-term health impacts. Keep the government informed of the situation and its impacts to better shape funding, allocation, and policy making. These efforts allow us to strive for better preventative measures in similar communities. To conclude this presentation, these are the main points to keep in mind. Everything must go somewhere. This concept especially applies to urbanization. Out of sight and out of mind is not a privilege many communities have. The Mbeubeuss landfill is one example of how lack of planning for urbanization can impact the health of the community. We must consider the health impacts on people with and without the Mbeubeuss landfill when creating interventions. And finally, utilizing the existing local infrastructure and community will maximize the impact of the intervention. Thank you for listening.